This is Sunday Focus, a weekly public affairs program that looks at the topics affecting our society and the people who are making a change in the community each and every day. The people who have vision for the next generation. Sunday Focus presents new challenges for us, keeping you informed with topics of local and regional interest. Now the host of Sunday Focus, Christine Manica.
Hello and good morning. Welcome back to another edition of Sunday Focus. September, it's National Suicide Prevention Month, and for the third year, Avera Health is launching its Ask the Question campaign. This campaign is built around the research-based premise that being direct can save lives. Asking someone who is struggling a direct question, are you thinking about suicide, in a caring way can open a meaningful conversation that leads to the person at risk to get help. It's not always an easy conversation to have, but on the bright side, suicide rates have fallen here in South Dakota for 2 years in a row. To tell us more about what programs Avera offers for the community and events involving starting a conversation, Thomas Otten, the Vice President of Avera Behavioral Health, joins us right now over the phone. Thomas, good morning. How are you?
Good morning. I'm doing fantastic.
Thank you so much for joining the program. And before we get started here to talk about Avera's programs and ask the question, tell us a little bit about yourself and your background.
Sure. First, I'd say thank you so much for allowing me the opportunity to talk here. Obviously, this is a very important topic to our community and to me personally, so I appreciate you taking the time to talk about this important topic. My background, I am a born and raised Sioux Falls kid. The only times I've been away was really for college. I went to Oklahoma Wesleyan University down in Bartlesville, Oklahoma for undergraduate, and I lived in Vermilion for a few years and got a couple of different master's degrees in educational psychology and counseling down in Vermilion. So I've worked in the field now for over 30 years or so in the behavioral health field. And I'd really say kind of my passion for this began in my childhood. My parents adopted a family of 4 children, and they had dozens of foster children prior to that really began kind of a journey for me where I learned the importance of behavioral health and trying to help others.
That's wonderful. Is that really the start of your interest in behavioral health? Because I know you mentioned, too, that you had a personal side of this, too.
Yeah, I definitely started in that childhood in seeing, so many different foster kids come in and out of the home who struggled with different behavioral health things. And my mother, in particular, was a consultant for the state of South Dakota on behavioral health type issues, and really her only experience was as a foster parent and adoptive mom, but she handled that so beautifully. And so it was kind of the beginnings of that. My parents also listened to a radio show back in the day that was James Dobson, focused on the family. He was a psychologist who talked on lots of different psychology issues. And so as we would travel in the car for long distances, that's what I got to listen to, and it really kind of piqued an interest.
Must have been kind of cool growing up as a kid saying, I have all these brothers and sisters, and I am learning so much about them, and they're really becoming like part of your family.
Yeah, absolutely. Yep. I was just telling somebody, my mother just passed away here in April. We had all 10 of the kids there, and you couldn't tell who was the adoptive kids and who were the biological kids. It's really been one of the most important days in our family's history. Was the day we adopted the 4 kids.
Oh, that's a wonderful story to share. Sorry about your mom, by the way. My mom lost her mom back in February, so I totally understand what you're going through there. Let's run down some of those statistics of the suicide rates here in South Dakota. We mentioned earlier how the good news is they have fallen here in South Dakota. What other information or data can you share with us, Thomas?
Yeah, well, let's start at a national level, and I just say, the numbers are staggering. There's an estimated 12.3 million different people have contemplated suicide in America. 1.7 million over the course of the last year attempts of suicide. And for the first time ever as a country, we're over 50,000 suicides, people who lost their lives to suicide. So certainly from a national level, it is a very serious concern. As you referenced, it has gone down for a few years. In 2021, we had 202 suicides in South Dakota. It went down to 192 the following year, and then in 2023 down to 180. So certainly there is some success and some good news, but I don't think anybody could be excited about 180 suicides. It still does make South Dakota the fifth highest per capita place of suicide, and probably as alarming or maybe more alarming than that, it is the number one cause of death for people in the age between 10 and 29 in South Dakota. I think it's number two across the country, but it's number one in South Dakota for that age group. So the other thing, about South Dakota, it's guns is the number one way of suicide in virtually every state. Definitely a very strong majority across the country. It is also in South Dakota, guns to be the highest. Hanging is the second cause of suicide deaths in South Dakota.
Wow, there's a lot to unpack here, Thomas, when you bring up those numbers and statistics. First, talking about the little lighter side of things, when we do talk about those numbers falling here in South Dakota, why do you think that is happening here in recent years?
It's a really good question, and I would say suicide is a very multifactorial issue. There's not one thing that creates suicide or causes suicide. It's many different issues, and I'd say the solutions are kind of the same way. So it'd be really hard to say, okay, here's the reason why things have gotten better. I can point you to a few things that I think are important and that I think are going in the right direction. But certainly, it's a very multifactorial solution to this as well. I certainly would praise that the state of South Dakota has been running a campaign for the last couple of years around suicide awareness. It's been very positive. As you referenced earlier, Ask the Question. Avera has ran this campaign now, starting the third year. And certainly I think those things help. I wouldn't point to them and say that's the reason that suicide's down, but I certainly think both of those things help us. I think there's been more focus. COVID did a lot of negative things in our country, but one of the things that I'd say is maybe a silver lining is there has been more focus on mental health issues, and there's been a more normalization of behavioral health. I think people start to realize that, this is you and I. This is all of us going through different times. And so, I think that national attention to behavioral health and certainly things like the 988 line that came into existence, it's a very simple number to remember. There were always suicide hotlines, but you had to remember your state's number to call, and now 988 nationwide certainly is a move in the right direction. So I think there's those would be some of the things that I think are helping us or helping us in the right direction for suicide.
When you look at the nationwide numbers and you compare it to South Dakota and South Dakota being at the top of the list, is that shocking to you? I know it's shocking to me when you said that statistic.
Yeah, fifth highest, and it ranges. Some years it's a little different, but we are towards the top, and certainly that creates concern for a lot of us. I do think there are pockets in South Dakota that, we have some of the very poorest counties in America reside in South Dakota. And so certainly poverty, while, again, not a reason for suicide, it certainly is one of those factors that leads to lots of difficult outcomes. And so, I think there probably are, it is why it's so important, I would say, to Avera, is because suicide is the fifth highest per capita is right here in South Dakota. This is something we've got to stand up and do something about.
Absolutely. If you are just listening right now, we are being joined over the phone line with Thomas Otten. He is the Vice President of Avera Behavioral Health Services here in Sioux Falls. And we're talking about Ask the Question, the campaign with Avera. And along with, again, asking the question, there are many great programs at Avera that benefit suicide prevention efforts like the Zero Suicide Initiative. Thomas, can you tell us about this and other programs you have at Avera?
Yeah, Zero Suicide is a journey that we have been on for about 10 years now. And so it really stems from the concept of a very audacious goal of zero suicide. Now, will we ever reach that? The goal would be that we would never have a patient who touches Avera's system and later has a suicide. It's a, as I said, very audacious goal, but what other number than zero would you be okay with? I mean, you can't say, well, if we only could get it down to 50 suicides, we'd be okay with that. So you really do have to set what might be an unrealistic goal, but still an important goal for us to say, this is what we're trying to achieve. So there's a whole series of interventions that we changed or that we've gone through over the course of the last 10 years to really focus on that. The first of which I'd say is a great partnership with the state of South Dakota to just look at data. So they will provide to us all of the patients in the state who commit suicide. They can cross-reference that versus all of the patients that ever touch the Avera system. And we will look for any patients that ever touch the Avera system. Sometimes it's 15 years ago in an ER, and sometimes it's a month earlier at their primary care visit. And so we look at all of those that committed suicide and touched Avera. We look through those cases. We try to identify what were the precipitating events, what were the factors that really led to suicide. And maybe it was naive of us to think that there was going to be something, because the truth is, when we got right down to it, there were a few things, but the vast majority, 73% of the cases, we couldn't identify anything in the medical record that would have said this is going to be a suicide. As I said, there were a few financial loss, relationship loss. There were a few things that were in the 8% or 5% range. But, when you look at 73% of the time, the medical record doesn't have any clue of why that suicide occurred. It does tell you, this is largely what we've learned is this is largely an impulse decision. In years past, if you go back 10, 15 years ago, we would have said, suicide happens at the end of a long bout of depression, and you go through kind of these phases, and you see them starting to get depressed, and you see them start to withdraw, and then maybe they start giving things away. And suicide happens at the end of that. And sometimes it does happen that way. I don't mean to minimize that, but very, very frequently, it's a much less, you don't see all of those pieces. It's an impulse decision, and it goes from 0 to 60 in a second, where, you might see cases where there was no warning signs. In fact, when we looked at the cases that have ever touched Avera, less than 50% had ever been seen in behavioral health. So I think, there's an important lesson in all of that we need to safeguard as much as we possibly can. So if it's an impulse decision, we know that. And two, we know that guns is the most common way of suicide. How can we partner with patients when we know that they're in a difficult spot? So one of the things we learned from Zero Suicide is really about the means of suicide, critically important. If someone pulls the trigger in a suicide attempt, about 93% of the time they end up dead. With the vast majority of the rest of the time, they'll have lifelong injuries. If someone takes an overdose, it's about 3 or 4% will end up dead. And nobody's excited about 3 or 4%, but when you compare it to 93%, it's just such a difference that you have to have a conversation with the patient of how can we partner with you? Can we get the guns out of the home? That would certainly be our first choice. Mm-hmm. If they say, no, those are my grandfather's guns. I've had them in my house since the day I was born, and I can't get them out of the house. They're too important. Well, can we get the ammunition out of the home? Can we get the guns and the ammunition both in different cabinets that are locked? Can we get even a trigger lock? Anything that will potentially break up that impulse. Because from the moment I've decided I'm going to commit suicide to the time it happens is hours, if not minutes, in some cases. And so anything we can do to kind of break that impulse might just save a life. So certainly, Zero Suicide has taught us a lot about means reduction. Even just in inpatient hospitalization, I would say, we used to say we're going to treat the depression. We've got medications, we've got counseling, we've got all these different things over over time, we've really learned that you can treat suicidal thoughts. So you really address kind of the suicidality piece as much as you do the depression. Now, obviously, we want to help long-term with the depression too, but the importance of really honing in on the suicide itself is an important piece of kind of what we've learned about how to treat during zero suicide. So I think all of those interventions, and we do, a PHQ-9, which is kind of 9 questions that will really help us determine kind of a depression screening, if you will, can be an important component of that. There's a Columbia suicide severity screening that we do with every patient multiple times while they're here that really is a component of that. So lots of different interventions that really make up zero suicide.
What you're saying, Thomas, it makes absolute sense with that 73% being unidentifiable. I think that just goes to show you that you really don't know what a person is going through behind closed doors. They could be happy, bubbly, energetic, outgoing, but then you don't know what happens once they go back home. So I'm assuming there's programs at Avera that can help someone identify maybe someone who is going through a hard time internally, or someone that can have those conversations with people like that.
Yeah, absolutely spot on. You're right on the right track. And so, yeah, I'd say lots of different things at Avera that we work around those pieces. So I would start with our urgent care program. Urgent care we created in 2022 through a generous gift from the Helmsley Charitable Trust. We added the Helmsley wing here. And the urgent care is on the ground floor of that. And we created it to be the easy button for behavioral health. It can be sometimes complicated to navigate, do I need a psychiatrist or a psychologist or a counselor, or do I need inpatient, or do I need something different? And so we created the urgent care as really kind of that easy button. Anybody can come there 24 hours a day, 7 days a week. And it functions very similar to an emergency room. I would say a behavioral health emergency room, we don't call it emergency because it doesn't meet the trauma standards of an emergency room, but really short of that, I would say, it functions very similar. You're going to be admitted by a nurse who will triage you, get all the vital signs, make sure medically we're okay. We'll get you into one of the consult rooms where you'll be meeting with a counselor who will do a biopsychosocial evaluation, kind of a total evaluation of what's going on right now, what's the crisis, what's happening all around that crisis. And then we'll have an advanced practice provider come in, either a nurse practitioner or PA, that would come in at the end of that and do kind of the medical component, playing the role of the ER doctor, if you will. From there, those 3 disciplines, nurse, counselor, and advanced practice provider, will help determine a plan of action for you. So if that's, you need to be admitted to the hospital, we'll certainly work on helping you get that accomplished. If that's, you need to see a counselor, or you need to see a psychiatrist or some other service, whatever it might possibly be. It might be a referral into our partial program. They'll set that level of care, and they'll help you coordinate getting into those services. So urgent care really developed as kind of our easy button. Some of the things that they refer to, obviously inpatient. As I'm sure you're aware, we have inpatient offerings for ages from our youngest in the child unit, treats 5 to 12-year-olds, and we have one unit dedicated specifically to geriatrics. So we might have a 105-year-old. And so every age in between there, we have an inpatient program designed specifically for you. In fact, we have 3 different adult programs kind of based on diagnosis and kind of severity of where the patient might be, so that we can make sure that we can meet the needs of the entire community. We also have a partial hospital program. So sometimes we use partial instead of coming inpatient, and sometimes we use it as a step down from inpatient, where patients will come 20 hours a week, so either 8 to noon or 12:30 to 4:30 for about 3 weeks, and then they might step down to what we call intensive outpatient. So then it's maybe I'm coming 3 times a week for a couple more weeks. So all of those services are on the ground floor of our new Helmsley wing as well. And then, one of the lower levels of care is just outpatient. So you might see your counselor once a week, or you might see your psychiatrist, once a quarter. All of those outpatient services are available at Avera Behavioral Health as well. So try to have a full continuum of possibilities for patients.
Absolutely. Lots of great resources at Avera. If you are just joining us right now, being joined over the phone with Thomas Otten, the Vice President of Avera Behavioral Health Services here in Sioux Falls, going back to Ask the Question, this year's campaign. It mainly focuses on the teens in our communities. Thomas, you mentioned that the biggest age range for the suicide rate here in South Dakota is 10 to 29 years old. We're talking about having a conversation. Recently, going back home to Chicago, I attended a very sad service for a 15-year-old who unfortunately did lose her life. And it's so surreal to see her friends saying, she was on cross country. She was very happy, doing well in school, and you really just never know. So when you talk about focusing on the teen community for Ask the Question, what are ways that Avera is really asking the questions to the teens?
Yeah, great question. And as you referenced, it was the number one cause of death in kids age 10 through 29. So that's an alarming statistic that's in South Dakota. So we're a number of different factors. Certainly, partnering with the Sioux Falls schools and other area schools, SDSU and USD, is an important component. The schools is where kids are at that are in that age, and so anything we can do to partner with them has been very, very helpful. All of them have, signs. In fact, a lot of times they'll place those in the bathroom because it's whether we like it or not, there's still a stigma around using behavioral health. And taking a snap picture of a QR code in the middle of the hallway may be harder to do, but in a bathroom stall, in my own privacy, it's a much easier thing to do. We certainly have provided a lot of talking points and worked with the schools about suicide and how to partner with them. We've educated staff and faculty on this topic and families on this topic. In fact, the Sioux Falls School website, under the counseling tab, there's a lot of resources there and trainings that we've provided. In the past, we do a thing called Family Forum once a month. We sit down and talk about a behavioral health topic. The Sioux Falls School District and Avera have partnered to create that program. And I think that's referenced there at their website. So, in fact, even one of the innovative things that we did with that, we had the kids develop social media for other kids. So in one of the classes, they were developing TikToks or different social media outlets that would be used about Ask the Question and kind of made a contest out of it. So it's really been some creative ways of trying to partner with the Sioux Falls schools and other area schools and universities.
I think that's a good way to connect with the kids too, because you got to find a way to get to their level and to help them understand what this conversation is all about, because this whole topic, it's not easy to talk about.
No, it's a very difficult thing to talk about, especially if you feel from the patient's perspective. As somebody who's really struggling, it's a very hard conversation for me to have to say, hey, I'm thinking about suicide, which is why it's so critically important. If we see somebody struggling, if we see them feeling like they're hopeless, for sure, if you hear somebody talk about death or death wish or wanting to be dead or, sometimes even just anxious or anger might be signs that you want to look for, it's really critically important to ask the question. You asking that question is never going to plant the idea in somebody's mind if they weren't already thinking that. If they weren't thinking that, you asking that question is not going to create a suicidal person. But on the flip side of that, if they are thinking about suicide, you may just have the opportunity to open an honest conversation where you can get them to the help that they desperately need.
And this isn't just for teens too. This is for young adults, older adults. Really, it's all about asking the question. So maybe you're a loved one, you're a parent, you're a teacher. If you notice that something is off, how do you approach that situation? How do you safeguard your home? You kind of already hinted at that when we first started this interview.
Yeah, for sure. And again, asking the question, no matter who it is, you need to have some relationship. I think if you just walk up to somebody randomly in the Empire Mall, it might be an odd question to ask. But if you have a relationship with somebody and you see they I think it's a critically important piece to start that conversation. And then you intently just listen to what that answer is. You don't have to have all of the answers. Let's get them to the help. As I mentioned before, we have the urgent care is certainly an easy button for that. 988 is a line that's available any place, anywhere you're at. You can get them in touch with a phone call at 988, or they can certainly chat with our helpline as well. So I think safeguarding a lot of that is really around that partnership around guns. Guns is not the only way that people hurt themselves, though. I mean, medications and a lot of other things are conversations that you can certainly have. We have a handout on how to safeguard your home and certainly provide that to patients. The helpline and 988 suicide hotline also has that handout. That, in fact, I think they're the ones that generated that. So it's a lot of partnerships across the community here that really work on this very important topic.
Thomas Otten, again, with Avera Behavioral Health. He's the vice president of that. Thomas, before we let you go, it just wrapped up the 437 project. Avera was the presenting sponsor of that. What a great event that is. For anyone who doesn't know what the 437 project is, can you explain it to us?
Yeah, in this community, we're very fortunate. I would say we have a mayor who has a passion for behavioral health and addiction issues. I think this is largely a brainchild of Mayor Tenhanken and some of his close friends got together, and they really decided they wanted to run across the state. So 437 is the number of miles from edge to edge of South Dakota, from the west all the way to the east. And so, yeah, as they wrap up today, it is a group of people that have jointly ran 437 miles, which is pretty incredible in itself. But really, the important message is why they run those 437 miles, really to bring awareness to this topic of suicide. All the proceeds go to the helpline, which is a phenomenal agency in our community that runs our 988 suicide hotline. And so it's a really cool event, and we're really proud to be a sponsor and part of it.
Awesome. Again, it's Thomas Otten. And Thomas, for anyone who has any questions about Ask the Questions or other services that Avera Behavioral Health offers, what's a good website or a phone number to call?
Yeah, the website for Ask the Question is avera.org/Ask the Question. And there's tons of resources there for families and schools and other people to take a look at and utilize if you desire. Everything there. Something we're trying to just help our community.
Anything else you'd like to add?
No, appreciate the time today and appreciate, again, your focus on this really important topic.
Absolutely. Again, Thomas Otten, we appreciate you. Thank you so much.
Thanks, Christine.
St. Joseph's Indian School is much more than a school for Native American children.
It's like a family. Classes are fun here. I am learning about my culture.
Since 1927, St. Joseph's Indian School has provided children the education, health care, and support they need to succeed. To help give our kids brighter futures, learn more at stjo.org today.
A whopping 78% of consumers say it's important for them to shop locally owned businesses, and they plan to do it more this year. Most consumers realize that supporting locally owned businesses has a positive impact on the local economy. In another study, small business owners shared their main challenges in running their business today. Number 1 on the list was standing out from the competition. Number 2 was their budget. And number 3, choosing the right marketing tactics for their business. And 4th, lack of expertise. We specialize in helping businesses differentiate their business within their budget using a variety of tactics. I'm Chad Jacobs with Results Town Square Media. We create and produce effective strategies for video, streaming TV, radio, digital, and live events. We evaluate the growth potential in your category, your competition, and the barriers to growth. Then, and only then, we'll tell you if we can help you. You see, we care more about growing your business than selling you.
I'm Christine Manica, and you've been listening to another edition of Sunday Focus. Thank you so much to Thomas Otten, the Vice President of Avera Behavioral Health Services, for joining the program today. Join us again next week for another edition of Sunday Focus.
Sunday Focus is a public affairs program of Results Radio Town Square Media, Sioux Falls.
Get 15% off a set of Brake Best Select, Select Pro, or Import Direct brake pads and 2 rotors now at O'Reilly Auto Parts.
O'Reilly Auto Parts.